knows in this room. But tell us about this. The differences in philosophy is what we're talking about here, whether it's about what the problem is, really solving the problem is, whether Americans have stomach for the problem, and that should be what's driving the solution. All of these things we've been talking about on the table. We touched on healthcare, Social Security. We've been having a fabulous time. How would you define the problem?
The problem is not the immediate deficits, which are necessary to deal with the most severe economic downturn since the Depression. And I think we go in the wrong direction when we start saying things like, we can't afford to extend unemployment benefits, which we need even for jobs, so that those workers will have money in their pockets to buy products and businesses don't lay off more jobs. The problem is the long-term structural imbalance between the level of revenues that we bring in and the amount that we expend. I don't think there's any mystery. That is the core of the problem, and we have to deal with that long-term structural imbalance.
Well, let me turn the corner then to something which I'll direct to you first and then to the other members of the panel, which is taxes. Pete Peterson, among others, believes that that is something which we ridiculously take off the table all the time, when in fact that's part of the solution to the problem. Not the entire solution, but part of it. How much of the solution do you think it ought to be?
Well, the first point is the key one. Nothing can be off the table, and certainly not revenues. Revenues has to be a substantial part of the problem, especially in the short term. Let me explain why. Healthcare costs are the single biggest contributor to the problem. Healthcare costs system-wide. As Bob Reischauer said yesterday to the Commission, I know you're a member of the Commission, Congressman Ryan, you cannot year after year have Medicare and Medicaid costs grow significantly slower than healthcare costs system-wide. It can't be done. Or at least it can't be done without a wildly two-tier system in which we throw lots of our citizens out to dry and don't let them have the benefits of modern medicine. So we have to find ways to slow the rates of growth of healthcare system-wide. But we don't know all the ways to do that. It's going to take us time. It's going to be a number of years before we get major savings there. We know we have to close the long-term Social Security shortfall. But there's bipartisan agreement that we're not going to slash benefits for people who are already retired today. Any changes in Social Security will be made gradually and phased in over a long period of time, as the Greenstein Commission did in 1983. That means not only that in the short run, the single major place that you get most deficit reduction from is going to have to be revenues, and over the long run, it's going to have to be a balance. In the long run, the single largest contributor, I think, has to be from slowing the rate of growth of healthcare costs, but no one thinks we can slow healthcare costs so much that you could do the whole job there, because there will be medical breakthroughs, and they will save lives, and they will improve health, but they will add to costs.
Let me ask Neera Tanden to weigh in on that.